A patient may survive cancer medically, but still lose their home, savings, or job during treatment. Today, we're talking about financial toxicity and how oncology navigators can help patients survive both cancer and the cost of cancer. Welcome to the Voices in Oncology podcast. Today, we're discussing one of the most overlooked burdens in cancer care, patient financial toxicity. Financial distress impacts treatment decisions, mental health, medication adherence, and overall outcomes. Oncology nurse navigators are often the first people patients trust enough to say, "I don't think I can afford this." I'm Aimee Faso, and joining us today is Amy DePue, an experienced clinical oncology navigator who has worked closely with patients facing the emotional and financial realities of cancer treatment. Hi, Amy. It's good to talk to you.
Thank you for having me today. It's good to see you.
Mm-hmm. So first, can you define what is meant by financial toxicity?
Yes. Financial toxicity refers to the financial burden and stress that patients experience because of cancer treatment. It's not just medical bills. It includes lost income, transportation cost, insurance deductibles, medication copays, lodging, childcare, utility payments, and even food insecurity.
Wow, so this becomes another side effect of treatment.
Exactly. Patients can experience anxiety, depression, treatment delays, and even skip their medications for side effect management because they simply can't afford it.
So as navigators, you often see this before anyone else in their healthcare team would notice.
Absolutely. Patients can frequently not say anything to their physician because they don't want to let that physician down, or they don't want to acknowledge that they can't afford their treatment, but they'll quietly talk to a navigator and tell them how worried they are about having enough gas in the car or money to buy the gas or pay their rent or their mortgage, or having enough insurance coverage to be able to have a complete workup to know the depth of their disease. So this happens sometimes even before treatment begins. I think patients are often feeling like they have to choose between healthcare issues and daily living. So it's true for those who are insured, as well as those who qualify for Medicaid programs. This is also true for retirees on fixed incomes. And I have to think about that young cancer patient who may just be starting out in a new job, or the young family who's caring for themselves and their children, but also other family members, that term the sandwich generation. So the complexity of the cancer diagnosis is compounded by the emotional pull of feeling anxious or guilty or overwhelmed about not being financially prepared for this diagnosis.
I was wondering if you had a specific patient example.
Yes, I have many of those patient examples. Part of what my job as a navigator is contacting patients who are newly diagnosed with breast cancer. And so in the course of the conversations that I've had with quite a few of these patients is always a concern of how they're going to pay the initial cost of the copay for their imaging, or how much the surgery is going to cost. And there's almost always, that's a fair question, right? That's a fair question from all of us, but I find it's coming more frequently from those folks who have reached maybe their mid-50s and their children are now in college and they're paying college educations, and they're they don't want to interrupt any flow for any of that family. So I do have lots of patients that I could talk about, but that I will just say that on the whole, that is one of the major topics of conversations that I have with these newly diagnosed patients, trying to figure out what those resources are.
And I imagine many patients just feel too embarrassed to discuss the financial situation that they're in.
And that's very true. And so it's one of the reasons why navigators, oncology navigators, are really important upfront want to be one of the first people that these patients really get to know. And it may be that that conversation is touched on briefly in the first couple of conversations, but that's why navigators have to be on that front line. It's one of the things what we can always say to them is, many patients are struggling financially, but let's talk about that now. Let's talk about some of the ways that we can head this off.
Yeah, so what are some of the practical ways that oncology navigators can help patients reduce financial toxicity?
Well, early assessment is key. So the sooner we identify the risk, the more options we have. And it's also why early access programs are vital to patients with newly diagnosed cancers. Among other things, opening the door to discussion about financial needs can lead the way to better outcomes and less anxiety, not just for that patient, but for the patient's family and the caregivers, as well as the entire treatment team. So during the initial conversation with a navigator, the patient can focus on some of the busy work of getting to treatment. And those would be things like filing for short-term disability, submitting FMLA paperwork for job protection and stability, applying for financial assistance and making referrals to other programs like gas programs, food programs, etc. It's really essential for the financial navigators to get involved. The patients may not even realize that there is a financial navigator available, but clinic navigator can be really essential in getting that patient connected to the general navigation team, as well as the medical social workers, but also those financial navigators. So moving into the treatment phase is a whole lot less stressful, and the patient's more fully prepared to start treatment.
So I imagine just connecting the patient to one of those resources could change everything.
It really can. One of the biggest disasters sometimes that we run into with new patients and starting new treatments is understanding differences in paperwork. We talk a lot about job protection, but I don't think a lot of patients fully understand the difference between the Family Medical Leave Act paperwork, the FMLA, versus the short-term disability and long-term disability paperwork. So when these navigators are meeting these folks early on, that discussion needs to take place. If the patient is employed, we want to make sure that they keep their job, which would be the FMLA paperwork that helps them maintain their job for a certain period of time. It does not, however, guarantee that they will continue to get a paycheck during that time. That's kind of a totally different subject. But for those who have paid into short-term disability paperwork, or who through their employer, getting them to get that also filled out can kind of close a gap between getting a paycheck and not getting a paycheck. In the long run, that's one of the ways that navigators can kind of close that gap and be kind of helping prepare these patients for what could be coming up.
So financial toxicity sounds complicated, but I also am hearing that it probably affects emotional well-being as well.
It does. So just, if you can just imagine already being overwhelmed with some of what life throws at you on a daily basis. And I mean, so thinking about that mid-30s patient who probably has a couple of kids, maybe one's still in diapers, maybe both are still in diapers, and they're worrying about the day-to-day of what happens just in the course of that day, and they get this diagnosis. All of that stress, where does it go? What do you do with that? So helping them get through that is really very important to what eventually comes out as the outcome of all of their treatment. So it kind of lays heavily on the navigation team to make sure that those things kind of line up and are in place.
So navigators carry this emotional weight with their patients.
Yes, we do. It's really difficult watching people struggle and still try to maintain hope and clarity about what we are trying to get to in the end, dealing with the patients and their families, their caregivers is a big struggle. But when you stop and look at each individual patient, it is so worth it when they are standing there ringing the bell, hitting the gong, having the infusion staff saying congratulations, or for she or he is a jolly good fellow. When those things come around, that it's everything has been done that needed to be done, and it was a team effort to get it all taken care of.
Yeah, so oncology navigators play such an important role in helping patients understand and move through the system of financial toxicity. What changes would you like to see in oncology care concerning financial toxicity?
I would really like financial screening to be as routine a conversation as a pain screen or a nausea screening or any of the other 15 things that we talk about with our patients during the course of their treatment. I think making sure there are consistent checkbacks over the course of the treatment time, as well as revisiting these questions during survivorship. Financial health affects outcomes. It affects the adherence and quality of life, the adherence of treatment. So early intervention and then throughout the journey is I think key to getting this patient off on the right start, the right foot. Assistance programs change constantly. I mean, so medication assistant programs, regulations for what benefactors are going to pay for, that changes all the time. So keeping that patient updated keeps them connected, which is also important. I often think about, you asked for a very specific patient, and so I'm gonna tell you about this patient who actually was older. She geriatric patient at the age of 72. She had gone through her treatment. It was a small breast cancer, and she went through her treatment, finished everything up, was doing well. She was ER positive, so she was on an aromatase inhibitor. And because of her age and several other things, we were following along with a bone density test just to make sure we weren't doing other damage. And she called me one afternoon and she actually started out pretty angry. She ended up in tears, and what she was telling me was that she could not afford to keep coming in to do these bone density tests. Now, we all know that we normally do bone density tests every 2 years, but when we're also looking at age and other comorbidities, sometimes those are done once a year. So in the course of me talking with her and trying to get her calmed down so that she was able to hear what I was saying and I was able to hear what she was saying, we started talking about just general day-to-day living. This woman was also, which I forgot to say, this woman was also still working in a diner. So at the age of 72, she's very active. She's doing all these things. She's also married. And she threw out a statement about her husband was a veteran. And so there should be something, somebody should be able to do something. And it was like a light bulb going off in my head. And I looked back on her demographic and I said, well, wait a minute. Your husband was discharged honorably. And she said, yes, he was a career man, 30 years. And I said, well, does he have TRICARE? And she says, he does, but I don't. And I said, oh, why not? You're also, as his wife, you are also entitled to that benefit. And so that conversation quickly turned around, and I did some more digging, gave her the information she needed to so that she could provide the information. And within the next 2 months, she was set up and she was getting that bone density test.
Wow.
And, so that's the example. It's asking the question, it's being persistent, it's working together towards the goal of treatment and survivorship and living, continuing to live.
Yeah. So being there and listening, you were able to really take a burden off of her shoulders.
Yes, ma'am, I was. Glad to do it.
Financial toxicity may not appear on a CT scan or lab report, but its impact on patients is very real. Oncology navigators are uniquely positioned to identify barriers early, connect them with the support, and advocate for compassionate, equitable care. Amy, thank you so much for discussing this important issue. And I thank you for listening to Voices in Oncology from STO for this important conversation. We hope that you will join us at our next episode when we discuss how one major medical facility meets patients' financial stress head-on. To learn more, please visit our website, sto-online.org.
Voices in Oncology is produced by the Society for Translational Oncology, STO, for educational and informational purposes only. Content does not constitute medical advice and should not be used as a substitute for professional clinical judgment. The views and opinions expressed by guests are their own and do not reflect the official position of STO. Mention of any product, service, organization, or therapy does not constitute an STO endorsement. Clinicians should exercise independent judgment in applying any information discussed to patient care.